Too many men are dying from diseases that could have been prevented.
Every one of those deaths is needless and senseless and a tragedy in itself.
Not because treatment doesn't exist, but because they waited too long.
Ego, fear, and silence are costing lives every day.
The doctor randomly asks, have you had a prostate exam? And I'm like, no, I haven't. About 15 minutes later, doctor, I was having a prostate exam. That's why we sat down with Dr. Greggory Pinto, a world-class urologist and surgeon, to talk about men's health, women's health.
Getting help for erectile dysfunction without exaggeration can save your life.
I feel vindicated on behalf of all women that there is a male version of menopause.
Why early detection matters.
There are no symptoms until it's too late.
And how you can add years to your life and life to your years.
One of the more addictive drugs on earth is caffeine.
This is a conversation that every man needs to hear and every family can benefit from. This is Finding Harmony. Seeing a white coat once or twice a year is better than seeing them every other week.
I am so excited for today's episode of Finding Harmony because we have a very special guest by way of Dr. Greggory Pinto. Dr. Pinto, I love being able to chat with you. I've learned so many things from you already. And I think that so many men, I guess, and women by extension in particular, need to hear about the things that you have to say. Because I think you're a real voice to the Bahamian community and I guess the world about men's health and how to optimize it. So thank you so much for coming.
It's a pleasure to be here. Thank you for having me.
I must say, Davrielle did prep me. She did give me a heads up. She was like, Dr. Pinto, he's a straight shooter. He's going to tell you what it is.
I try to be. Yes.
He's not going to sugarcoat because these are serious matters. And
life or death, yes.
Life or death. So that's why, we want to bring you here to have these conversations. And obviously, from a male perspective, I'm very excited to have this conversation with you because I have questions as well. Well, that I hope to answer. But I first want to start off this conversation. I wrote this first question down because I want to make sure I get it right. Dr. Pinto, why are men here in the Bahamas and globally are still dying from diseases that we know are preventable?
A lot of it is fear. A lot of it is ignorance. A lot of men just don't want to know because if they don't address it, then they think that they can, it doesn't exist. And then one day it creeps up on them. And then someone who doesn't want to see a physician even once a year, doesn't want to get one blood drawn for annual physical even once a year, is in and out of hospital, going to the emergency room 3 o'clock in the morning, having to go to have emergency surgeries or elective surgeries, and their whole life becomes what they hated. And that's any intervention related to the medical field or seeing a physician. So if you want to stay away from physicians, which is fine, just do it once a year. At least get your annual physicals. If you have a non-communicable disease like hypertension, diabetes, you may need to see a physician twice a year or 3 times a year, depending on its control. But living in ignorance is ignorant because eventually it's going to wreak its ugly head, whether you're 15 years old or 35 years old or 85 years old. And things that we can reverse can become irreversible. And for most men, the most important organ for them is their male organ so that they can perform sexually. The first thing for almost every non-communicable disease, what is it going to affect first? It's going to affect your erections. So actually swallowing your pride, coming in to get a full workup as to why you have erectile dysfunction, and everybody's going to have some form of erectile dysfunction, every man, at some point in their life.
It's not unique.
It's not unique. So if you're suffering needlessly, and every day that you suffer needlessly is one more day that you could have been enjoying your life. And for a lot of men, they become withdrawn from society. Their relationships suffer. Their personality changes. They can have depression. They can have sleeplessness. It can affect their professional goals, their career, because they feel a shell of their former self. They don't feel like a man. They become more timid. So why live your life in shame when everyone has that problem and we can do things to get you back on track? And I'm not talking about just treat the symptoms. We need to treat, as in everything in medicine, we treat the root cause. And if treating that root cause is, for example, determining that at 38, at 42, you have early cardiovascular disease, that can put you on a different road where not only will you get your erections back, but that that possibly can save your life, because that can stop you from getting a heart attack or maybe a stroke 20, 30 years down the road. So even in terms of, in layman's terms, anytime you're going to have any obstruction on your blood vessels, it's going to affect the smaller blood vessels first. The smaller blood vessels are the ones that are going to supply your male member. Those are going to become obstructed. You're going to start developing some form of erectile dysfunction. This is going to happen many, many years before the obstruction and plaque deposition affecting your larger coronary arteries that supply your heart, or your larger arteries that supply your brain, such as your vertebral arteries, your carotid arteries. Right. So you can literally change the path of some individual by not only getting their erections back on track, but it can prevent them from getting a heart attack or stroke and dying needlessly at 58 or 52. And everybody wants to know, why did my neighbor or my church member or someone from work all of a sudden drop dead? He seemed a picture of health.
Right.
But all kind of things were happening, and he was ignoring it.
I think that is, you kind of caught me off guard to say every male is going to encounter that at some time in his life.
So even if it's psychological or because of emotional issues or because of stress, but for many men in this country, because of the overwhelming amount of non-communicable disorders, every man's going to have it to some degree, even age-related, because every man's testosterone starts to fall from the age of 40, at least 1% to 2% per year. So just based on that, everybody's going to have some amount of decline in their erectile function.
So when you talk about the decline in testosterone, which is, I guess, expected or just a natural part of it, what are things that people can do, I guess, naturally, or do they have to take medication, or is that something that they're supposed to compensate for, or is that just
it all depends
the course of life?
The root cause. So if you're becoming symptomatic, then obviously we need to address it. Based on a blood value alone, we're not going to treat you. You need to have symptoms of that. So you need to understand the symptoms. So the easiest way of understanding is that you're in the male version of menopause. And a lot of men don't even realize what menopause is, but
I feel vindicated on behalf of all women that there is a male version of menopause.
So you're going to put on weight. You don't know why you're putting on weight, particularly adipose tissue around the midsection. You're going to have even brain fog. You're going to have cognitive delay and decline. Your memory is going to be affected. You're not going to be you're going to have some element of depression. The typical thing is that someone loves to do things, whether it's watching football on a Sunday or playing dominoes or going out with the boys or doing it and going to the beach. They just become almost social shut-ins. They don't want to do anything because they're fatigued all the time. So all they do is they come from work because they got to go to work. They don't even want to go to work. And they just sit on the couch. They may watch TV. Most of the time, they find the TV's watching them because they fall asleep at the drop of a hat. They basically walk around in constant fatigue, constant brain fog. Their sexual drive is gone. The ability to maintain their erections is gone. And then when you have low testosterone, you're going to put yourself at risk of obesity and being overweight. Both of those are going to put you at risk of obstructive sleep apnea. When you have obstructive sleep apnea, it makes the obesity worse, which makes the low testosterone worse. So it's a vicious cycle. And so many Bahamian men, and I'm talking about in the tens of thousands, are on this vicious cycle and they don't know what's happening to them. They don't recognize themselves. They're in a body they never thought they would be in. They got a whole new wardrobe. They don't want to do anything. Their whole personality changes. They may not really recognize it. They're irritable. They're short-tempered. They have heat intolerance. They're sweating in an air-conditioned room. They're going to lose their muscle mass. They're not going to have that endurance they used to have, that get up and go. So essentially, you're making a man who could be 45 feel like he's 85. And I'm not talking about a good 85 because we want to have a lot of good 85s, and I know a lot of good, but I'm talking about a bad 85. So you're fatigued all the time, you're depressed all the time, no interest in sexual activity whatsoever. You can't maintain an erection. So that in itself will cause depression. When you have obstructive sleep apnea, obesity, low testosterone, that can put you on the road to something called metabolic syndrome. So if you don't have hypertension, if you don't have diabetes, if you don't have an early amount of coronary artery disease, you're going to put yourself on the path for that. If you do have diabetes, if you do have hypertension, if you do have high cholesterol, all of a sudden it's a lot more difficult to control. And once you do that, your life expectancy is going to go down considerably. You can increase your risk of having a heart attack or a stroke exponentially. So essentially, it's the beginning of the end. So getting help for erectile dysfunction, without exaggeration, can save your life.
So I want to put a quick pin in there, right? Because I know you're talking to Dav, and everything that you're saying, for the most part, honestly, if I was experiencing for the last year. Now, I wouldn't say the erectile dysfunction, but I'm going to be really honest. You know? And it honestly is a pride thing. You're looking at me, but I'm being honest. But mostly everything that you said, because about a year and a half ago, I was about 65 pounds heavier than I am now. I'm on my weight loss journey.
Okay.
And a lot of things that you were saying, just in terms of just energy, just being tired, sitting down, walking up the steps
on the couch,
for me was, a chore.
So the typical scenario is that you wake up and you feel even more fatigued than when you first went to sleep.
Oh my gosh. Yeah.
A lot of men will even wake up with a little bit of a headache.
Yeah.
And for a lot of men, it's when they're middle-aged. And what do they do to get through the day? They're having caffeine all day. Coffee, tea, sodas with caffeine, energy drinks. And they're at that age where they already have some element of an obstructive prostate, where they're not already emptying their bladder. If you put caffeine all day on top of that, they're going to be peeing more frequently, more urgently, and it's just going to disrupt their life even further. And that's not solving the problem. Caffeine is a depressant. Caffeine just basically puts the fatigue and kicks it down the road, and then when the caffeine's out your system, you're going to crash. And then you're going to have more caffeine, and you're going to have more caffeine after that, and it's going to be addictive. One of the more common addictive drugs on earth is caffeine. A lot of people don't understand that. But people who don't have access to caffeine after taking it regularly for years, they're going to know what withdrawal feels like, because they're going to be anxious, they're going to be jittery, they're going to get headaches. It's a terrible, profound effect physiologically when you just stop caffeine cold turkey. So that's how you know it's a powerful drug. So when you wake up and you feel fatigued, you can sleep 10 hours. But there are two types of sleep. There's REM sleep and there's non-REM sleep. There's rapid eye movement sleep, where you have the time to dream, where you're having that replenishment of everything. That's the amount of sleep you need. Even if you get a little bit of REM sleep, that's going to be more important to you physiologically than 8-10 hours of non-REM sleep. So when you have obstructive sleep apnea, a lot of men don't realize it, but they're snoring loudly. That's classical. But a lot of men snore for many reasons. But you snore loudly, then it's your spouse who usually will tell you, you stop breathing like you're choking on your breath for a few seconds. And that is where what we call hypoxia. There isn't oxygen delivery to the organs, whether it's your brain, your heart, etc. And that's going to have a profound negative impact on you. So essentially, you stop breathing multiple times. And when it's bad for severe obstructive sleep apnea, that might happen 3 times every minute.
Every minute?
So when you replenish the testosterone that you use throughout the day, that happens only in REM sleep. So you're not getting sufficient sleep, you're feeling fatigued, and your testosterone is falling because you're not getting sufficient REM sleep. You're going to put on more weight. That putting on of more weight is going to cause the sleep apnea to get worse, which is going to cause the low testosterone to get worse, which is going to cause your erectile dysfunction to get worse. So, as I said, it's a vicious, negative cycle that most men don't even realize what's happening, but they feel like their life is over before they know it. And we can get them out of that. We can get them to lose. There was a study maybe a decade ago in Germany, a long-term randomized control study where they found that the average man who has obesity and obstructive sleep apnea, if we can treat the obstructive sleep apnea, in that study alone, the average man lost 70 pounds.
Wow.
And
70?
70.
Wow.
So that can change your life drastically. That can reduce your cardiovascular risk considerably. That can rebound your erections, your energy, your vitality, everything. So imagine just walking around with an extra 70 pounds that we can get you to lose.
All right. I feel like having this information is vital, right? But obviously we're sitting here with the doctor, you're talking to us, and we can readily get this from you. A lot of people are getting this information because they aren't visiting, right? Speaking from a male's perspective, we talk about, well, I feel a lot of times it's an ego thing, but also I feel it's also a fear factor, whereas you kind of know what's going on, but you don't want to have a strong idea because then it could be something else. For instance, I remember one time I went to the doctor with Dav. This is so funny because it's a part of this whole thing, but we went to the doctor for something else. And the doctor randomly asked, have you had a prostate exam? And I'm like, no, I haven't. About 15 minutes later, doctor, I was having a prostate exam.
Let's talk about the elephant in the room, because as a urologist,
first of all, I've been traumatized since then.
So that's something,
not what I was there for.
That's something maybe 15 years ago. Now, for first line screening, every governing body, Urology Association in the United States, Canadian Urological Association, the European Association of Urology, UK Surgeons Urology, every governing body that dictates how a urologist is supposed to practice their specialty, including prostate cancer screening, has stated, in fact, and there's these long-term studies have shown that it does more harm than good by doing the digital rectal. And in fact, there's a slogan by the UK Urology Association that says, no finger up the bum for prostate cancer screening. So there's even a quote, the American Urological Association guidelines for prostate screening. There is no role for the digital rectal exam in first-line screening for prostate cancer. First of all, it's very subjective. That causes, and only in this country alone, causes tens of thousands of men to never get prostate cancer screening. Even if they did, they're not going to do it again.
Yeah.
We garner no useful information because prostate cancer it happens when you're advancing age, for the most part.
Okay.
So when we start screening just with a typical blood test, PSA blood test, which is a routine part of any annual physical up to age 40, and every year after that, at least into the age of 75, that's all we need. Then if that's abnormal, we'll repeat it with more specific blood tests like the free PSA. We'll calculate your PSA velocity looking at the PSA 1 year to the next, because your PSA can be normal. And 15% of men who have a normal PSA actually have prostate cancer. But we need to talk about clinically significant prostate cancer. So every man's going to get prostate cancer if they live into their 80s, particularly black men. Right. But the vast majority of men are going to die with it, not from it. So it's a natural part of getting older. That's why everywhere in the world, Europe, Japan, United Kingdom, Germany, Canada, South America, every country, the guidelines are you stop doing PSAs at 70, because if you look for prostate cancer in that age group, 70 to 80 and above, everyone's going to have some element of prostate cancer. And even when we treat prostate cancer, the first thing we need to do is this person likely to live 10 years? Because for most prostate cancer cases, unless you're going to live 10 years, it's of no consequence. You're going to die of old age or whatever morbidity that you're suffering from before the prostate cancer causes your demise.
So why is it, saying that every man is likely to get it? Why?
It's just the way God made us, particularly black men. Inherently, we have risk factors in terms of the way, for example, we metabolize calcium. It's genetics, particularly if we're from West Africa, that has the strongest risk factor. So 1 in 6 of us are going to get prostate cancer in our lifetime in this country. 1 in 6 African Americans are going to get prostate cancer in their lifetime. In the United Kingdom, 1 in 4 men of either African or Caribbean ancestry are going to get prostate cancer. 1 in 4. It's the number one cancer in this country. The number one cancer in this country, far exceeding breast cancer numbers. It's the number one killer in terms of cancer in this country. Over 100 men are dying of prostate cancer. And I'll say this categorically. Every one of those deaths is needless and senseless and a tragedy in itself, because nobody needs to be dying of prostate cancer. We have so many ways to pick up prostate cancer where, in fact, we can pick it up so early where it's clinically insignificant that we can actively surveil someone, sometimes for a decade or more, before the prostate cancer becomes clinically significant. So prostate cancer survival for 5 years for early disease is almost 100%. 97, 98% for 10 years. No other cancer you can say that.
Wow.
No other cancer you can say we can pick it up, and because the disease is so indolent and of no consequence and so low volume that we can just watch you. You're not saying that for breast cancer. You're not saying that for colon cancer. You're not saying that for thyroid cancer or pancreatic cancer or any other cancers. But for prostate cancer, you can say that because 80% of prostate cancers are very slow growing diseases. In fact, particularly for Caucasian men who don't have any genetic mutations that may predispose them for a more aggressive form of the disease, studies have shown that for certain men, either we treat them or don't treat them, they live just as long. It doesn't matter. But because the second greatest risk for getting prostate cancer is actually being of African ancestry, we have all the demographics in our society for having not only a higher incidence of prostate cancer, but a more aggressive form. Obesity causes a more aggressive form of prostate cancer. Alcohol intake causes a more aggressive form of prostate cancer. Cigarette smoking causes a more aggressive form of prostate cancer. But there are things that we can do to limit our risk of getting prostate cancer. So it's not inevitable. It's not in the cards, even in terms of genetics, we can still do. So when we talk about genetic mutations, there are two types. There are those that are related to what we call somatic, and the somatic ones are ones that are modifiable. Those are ones that are environmental. Those are things that either we don't do, such as don't exercise, sedentary lifestyle, or things that we do in terms of our poor diet or environmental toxins that we're exposing ourselves to. And that includes alcohol. Alcohol is a poison. Bahamians don't want to hear that. But I'll even go further. The U.S. Surgeon General actually was advocating in January of this year because of long-term studies, nothing profound that no urologist or other physician would have known. But he categorically put out a study that's well-respected over many years that showed that there are at least 6 cancers that are strongly linked to alcohol intake. And I'm not talking about binge drinking or excess alcohol. I'm talking about even low levels of alcohol. I'm talking about even a drink every other day.
Really?
And it can significantly increase your risk of getting even prostate cancer and breast cancer. So they actually put it out in the study that 1 in 6 breast cancer cases in the United States is directly linked to alcohol consumption. So women in this country, because we have so many risk factors for not only breast cancer at an earlier age and a more aggressive form of the disease, they should drink sparingly or not at all. That in itself is going to reduce their chance of getting breast cancer.
And we're talking about wine as well, or just
any form of alcohol. Any form of alcohol. If you are worried about prostate cancer, drink sparingly or not at all. Make sure that you're a normal body mass index. Avoid obesity and being overweight. Exercise 3 times a week. Let's talk some positive things. If you ejaculate 21 or more times a month, you can reduce your chance of getting prostate cancer by, and I'm talking about low-risk prostate cancer, by 25 to 30%. That's considerable. This is in layman's terms, you're clearing the tubes of any buildup of carcinogens or byproducts or metallic substances or whatever that ends up in your prostate. So if you clear the tubes, you can reduce your chance. And this is not fictional. This is not science fiction. This is from a long-term Harvard study looking at 27,000 individuals where they looked at men who ejaculated 4 to 7 times a month versus those who ejaculated 21 or more times a month. And it's found that you can reduce your chance of prostate cancer by 30%. It was replicated in a long-term Australian study as well. Exact same number, about 25 to 30% reduction in prostate cancer risk by ejaculating 21. So that's excellent news.
So it's 30 days, 31 days in a month.
21.
Yes.
21 of them.
All right.
We should be ejaculating.
You know, I was curious because I've heard you say that statistic high level before, but I didn't hear the context behind it, that, you know, whatever environmental substances you may have picked up that's coming out of your bloodstream, that's coming out of your body. So that it makes sense.
Another thing you can do, sorry to interrupt, but you can reduce, and I always advocate that, avoid dairy milk. Because dairy milk has a lot of hormones in it. 75% of the dairy milk that we consume comes from pregnant cows. Those in particular have high rates of many hormones and breast cancer is very hormonal sensitive in terms of triggering it and causing it to proliferate and progress. Prostate cancer is the same thing. So estrogens and IGF factor also is IGF-1 is prevalent in dairy milk. And studies have also shown if you can limit your dairy milk intake to less than 20 grams a day, or they looked at in terms of the volume, less than 1 3/4 cups a day, you can reduce your chance of getting prostate cancer by as much as 25%. That's also something that we can do to prevent prostate cancer.
Now,
so avoid dairy milk, 21 ejaculations from whatever way you want to do it a month. Avoid having saturated fats, increase your fiber intake, avoid red meat, more white meat, more fishes. So essentially the Western diet is what predisposes us to get prostate cancer. Who has the lowest risk of prostate cancer in the world? Those within Asia, the continent of Asia. We look at Japan. Virtually nobody gets prostate cancer, and it's the diet. Also, it's their lifestyle. They walk everywhere. They bicycle everywhere. Here we drive. We look at the prostate cancer incidence of New Providence and Grand Bahama versus those in Long Island or Abaco or Rum Key or Crooked Island or Cat Island. It's lower there because they live better. They walk everywhere. They live off the land and the sea. They eat better. They live longer. They have less non-communicable diseases. They have less cancer incidence as well. The same thing for other countries where they have a healthier diet. The worst diet that we have is the Western diet. And studies have looked at that in terms of someone who lived in Japan and they moved their family to California in the United States, for example. Within one generation, their risk of prostate cancer is that of an American versus those in Japan.
Wow.
The same thing we looked at, there was a study that looked at men from Africa, 2 generations later having moved to Africa, taken on the habits, the customs, the diet, the active lifestyle of persons in China. So these are persons from Africa that moved to China. And they reduced their prostate cancer risk to essentially someone on par with someone from China. So there are things that we can do. If we change our diet to a healthier diet, and people don't want to hear that, reduce the fat, being overweight, reduce the alcohol intake, we can significantly reduce our chance of getting prostate cancer. And then the take-home message is prostate cancer is the easiest cancer to treat. No one should be dying of prostate cancer. And when 100 men die every single year, you can imagine the impact on our society. Most of these men are their primary care provider for their family. You can imagine the devastation to that family, to the extended family, to the community, to the church members, to the society, to those in their workplace. These are contributing men to society that should have seen their grandchildren walk down the aisle, should have seen their grandchildren have children, should have had those extra 25 years, golden years with their spouse, and they're leaving their spouse behind, crying and wondering what happened. They're having their granddaughter go down the aisle without the grandfather in the church, and it's a tragedy because it shouldn't happen. It's
preventable.
It absolutely should. So when you talk about, I'm not going for prostate cancer screening because of digital rectal, there's no part of digital rectal in picking up prostate cancer. And just in terms of clear understanding, when we do the digital rectal and the prostate cancer is clinically so low volume, early disease, your digital rectal feels completely normal. By the time you wait to feel something on digital rectal, that prostate cancer is already at a certain stage that we want to get earlier. You don't wait to go and do a mammogram when you feel a lump in your breast, because by that time you probably have 500,000, 1 million cancer cells already that have congregated to make that nodule. So we wanted the same thing. We want to make sure that we screen someone with a blood test. PSA is not what we call very sensitive or specific for prostate cancer. It's an enzyme produced by the gland itself. So there's so many things that can cause PSA to jump. A normal big prostate with no cancer whatsoever, little infection or inflammation of the prostate, a form of prostatitis, a form of incomplete bladder emptying. I always say this: you put a clothespin on your penis, and your PSA can be 30 by tomorrow based on the fact that you're in retention.
Wow.
A normal PSA is less than 4, quote unquote, because there's normal for age. There's a normal when you look at Caucasian versus African American. An average normal PSA for a 45-year-old obviously is a lot lower than that of a 65-year-old. And it's also very specific to that individual. For many reasons, someone's PSA might be higher than even your brother's. So that's why it's important to get a baseline. So we're not looking at PSA, which is prostate-specific antigen blood tests for prostate cancer screening in isolation. We're looking at it comparing 1 year with the next. And I always tell men they need to know their numbers. They need to know what was your HbA1c last year as an indicator of what your likelihood of either being pre-diabetic or diabetic, or if your diabetes is controlled or not controlled. What was your PSA last year? What was your PSA this year? Oh, you haven't gone for it? You better go before the end of the year.
I think the term PSA, obviously that's the blood test, but I think that there needs to be a PSA, for men.
Yes.
Obviously, public service announcement. You do not have to get a digital exam.
So I'm talking a lot of things that are doom and gloom. The whole way that we look at prostate cancer in terms of screening, in terms of surveillance, in terms of management, everything is going to change hopefully within a decade. It's changing at this moment. We actually now have what we call liquid biopsies, and some liquid biopsies are actually FDA approved. So basically, when you have a cancer that's early disease, these cancer cells are going to shed off some DNA fragments of that cancer. We can do take fluid from the body, whether it's, in some cases, it's just urine or it's blood. We can determine, for example, studies that looked at prostate cancer. In 3.5, 4, 5 years, you're going to get prostate cancer. Not only will you get prostate cancer, we determine whether it's going to be aggressive or not. That's long before the PSA shows anything.
Wow.
That's long before if we do imaging like an MRI, which is the gold standard for picking up prostate cancer. The same for breast cancer. It's the same for cervical cancer. So liquid biopsies can look for 20 different cancers and can tell you, all right, you're at risk of getting prostate cancer in the next 5 years. You're at the risk of getting pancreatic cancer in the next 15 years. So we can stratify someone, make sure that we diligently pick them up in terms of surveilling them. And then when we do find that they have the disease, we can get a cure at 100%.
Wow.
So that changes things considerably. So talk about digital rectal, when we're going to feel something when it's late. We can look, and this is not science fiction again, they're actually FDA-approved liquid biopsies, and there are more and more coming out where studies are going on where and they're available here. I have been doing liquid biopsies in the Bahamas for patients for the last 2 years, and it's remarkable.
It's changed the game.
The same person, we can do imaging, you won't see any sign of any prostate cancer. We can do the blood test, no sign of any prostate cancer. But as it foretold, 4 years later, we do the PSA, then it starts to climb. We knew it was coming.
Wow.
So that changes the way we look at cancer, and cancer is going to be very survivable disease no matter what cancer in the next 10 years. We also have, even for advanced disease, this has changed in the last 20 years, and things have become more specific. It's called immunotherapy, where someone might have died of metastatic disease, whether it's bladder cancer or pancreatic cancer, where they had lung mets, liver mets, nodes throughout, locally advanced disease. There wasn't much. We might have given them some palliative chemotherapy or some expensive drugs that were going to reduce their quality of life considerably. We can now give them immunotherapy, where we take out somebody's blood, we program their white cells to attack those tumor cells specific for them only, and put that blood back in, and basically it attacks the cancer and all the metastatic disease. You'll do an imaging, and then you do immunotherapy, and 6 months later, 9 months, you'll say, where is all the lung mets? What happened to the liver mets? All gone, like it melted away. It's almost like a miracle drug. And that's readily available in this country. I've seen persons that 25 years ago wouldn't have lived 6 months. They're still doing well with it's not just the number of years you live after cancer, it's the quality of years. They're having normal lives. They're at work, they're going on family vacations 8 years later.
Wow.
10 years later, 15 years later. So it's groundbreaking. No one needs to be dying.
So if I could just bring it back, what are some of the red flags, I would say, like red flags that relates to symptoms and related to, prostate cancer that we can look out for?
That's the problem there.
Right.
There are no symptoms until it's too late. So if you're waiting for symptoms, you're waiting till it's too late. That's why we need to diligently at least start with a PSA blood test. And if there's any concern, we do more specific blood tests. There's a 4K score. There's a PHI score. There's urine RNA. We could actually do a urine test that determines someone's likely to get aggressive prostate cancer or not. We can do gene testing. We talk about BRCA gene, breast cancer gene. It's not the breast cancer gene that we're concerned about. That's a big misconception amongst society, men and women. First of all, every baby born on this earth has BRCA gene, breast cancer gene, men and women, boys and girls. It's a good thing. It's a suppressor gene. It suppresses cancer. So when you have breast cancer, when we call BRCA gene mutation type 1, mutation type 2, that's where the suppressor gene of the BRCA is not functioning properly. So when you have cell replication, then there's some abnormality, and you have replication of abnormal cells that can lead to cancer formation. This suppresses that and stops it from happening before cancer forms. But when you have the mutation, that suppressor gene is not functioning like it should, and that's why you get BRCA gene mutation type 1 and type 2 can make your chance of getting prostate cancer within your lifetime 60% greater than if you don't. It can increase your risk of getting skin cancer, pancreatic cancer. For men can also get breast cancer as well. So that's something that men also need to be wary of. If you have a lump on your breast, please don't ignore it. That could be the cause of your death as well.
You talked about, obviously changing the perspective, not waiting for a red flag, not looking for a red flag. It seems, going back to what you said earlier, it seems for men, the temperature check really seems to be anything to do with sexual function. If there's any sort of decline there, that's indicative of something going wrong in their body. I know that you're a urologist, but you spoke a little bit to breast cancer and things like that. What would you say is the equivalent temperature check for a female to say something might be wrong?
Well, I had to be. I was a GP for many years before I went to specialize. I actually had to do general surgery before I even did urology. So I've treated for many years breast cancer patients. I've done hundreds of mastectomies. So I've been in breast cancer clinics where there are hundreds of women, and I did that for many, many months. So I've seen every aspect of breast cancer, and unfortunately, many men, many women, they come in too late. So you have to advocate your mammograms. If you have a family history, even consider doing gene testing, determine if you have the BRCA gene mutation type 1 or type 2. In this society in particular, we have very dense breasts, and the mammogram can miss a lesion. So even in those individuals who are high risk, we advocate for MRI of the breast. So we're not going to mince words. A mammogram is not the most pleasant experience. If you have the means, you can go for MRI. MRI is a more perfect tool, particularly for African ancestry women and for women who have denser breasts. But it's not a good screening tool because it's not inexpensive.
I was going to say, yeah.
So if you have the means, if you have the fear, if you have the family history, I would advocate for not just mammograms or breast ultrasound, but even MRI. And if, let's say, a woman went and had a horrible experience with the breast being compressed and doing a mammogram, and they'll just keep delaying it, and then a dozen years later, they go and force themselves to do it again. And in those intervening years, that's when the breast cancer. If you have the means, then get a mammogram. Every 2 years, every 3 years. That'll pick up a lesion very quickly with a high sensitivity and a high specificity. But again, things that we do and don't do. Make sure you're not overweight. Or you exercise. Make sure that you eat right. And that will reduce your chance of getting breast cancer as well. And then when we talk about breast cancer is a very, what we call heterogeneous disease. The breast cancer that you have, or this woman has, or that woman has, can be very different than their cousins or their sisters or the one their grandmother. There are at least 5 different subtypes of breast cancer, and the way we treat them are very vastly different. So decades ago, part of breast cancer was the first thing you knew is surgery. Now, no. We start with systemic therapy, whether in many cases it's hormonal, if you're hormonal sensitive breast cancer, or chemotherapy, because once you have breast cancer, almost every woman has some element of micrometastasis, cancer outside the breast in the bloodstream, in the lymphatics. So you'll start with some chemotherapy. Then, in many cases, when you go through all of that, by the time they do either the lumpectomy or the mastectomy, the breast cancer tumor is actually shrunk, and sometimes it's very, very small. So a lot of women think, oh, breast cancer is disfiguring, takes away my sexual organ. You can have immediate reconstruction. That's the least of your worries.
Right. It's important to have your life.
Exactly. There are some women, we can do prophylactic mastectomies because they have so many risk factors and they have such a strong family history that maybe at 35, they'll do prophylactic bilateral mastectomies and have immediate reconstruction right away. And they can even feel more sexual than that they didn't, because now they, in layman's terms, they'll sell it that perkiness that they may have lost after 4 kids. So
you're not subject to gravity anymore.
Exactly that.
Just speaking from a human perspective, right? How have you seen untreated and late detected diseases affect families?
Devastating. So let's even talk about dollars and cents in terms of economics.
Right.
It can be such a toll on a family. First of all, you're taking out a breadwinner, someone who's, if not paying wholly, the rent, the mortgage, the car payments, the school tuition, keeping the family going, or jointly keeping the family going. But the biggest tragedy is when you have a woman who has 5 children, who's a single mother with little to no support, and they're struck with advanced cervical cancer, or struck with advanced breast cancer, and it's not curable. What are going to happen to these 5 young children? And that's the saddest thing of all. Even greater tragedy when talk about cervical cancer, we had the means to eradicate cervical cancer in our society for the next generation. We have the HPV vaccine available for preteens and teen girls and boys that can eradicate HPV with a 94% rate. HPV is the #1 cause of cervical cancer. Almost every cervical cancer is related to HPV. So if we can eradicate HPV, human papillomavirus, which is the #1 sexually transmitted disease, by the way.
Wow.
We can reduce our chance of getting cervical cancer almost zero. Almost every case of cervical cancer that I've seen, and every urologist gets referred them because they come with obstruction of their kidneys. They're at stage 3 or stage 4.
I was going to say, similar to what you've said about prostate cancer, I've heard when it comes to the pap smear, when it comes to those screenings,
women don't go for pap smears.
If you get your pap smears, if you get them annually, the risk of you dying of cervical cancer is very small.
Almost zero. Yes. But if you have the HPV vaccine, you'll know that your daughter, your niece, your granddaughter are not going to get cervical cancer when they're of age.
Wow.
And I've seen 28-year-olds dying a horrible death for 5 years, 8 years, 35-year-olds, 42-year-olds. They had their whole life. And then they're in and out of hospital. Many times they're dying of kidney failure in the end. And I don't want to get too graphic, but to the point where they develop fistula with their colon or their rectum, where they're having stool coming out of their vagina. It's a horrible ordeal. These women look like they're skin and bone. And it's not even a pleasant odor. It's cervical cancer, any physician will tell you, has a very distinct and unpleasant odor. Imagine that woman living with that while they're slowly dying, trying to hug their children for the last few times before they die.
Wow.
It's not nice at all. And you reduce your chance of getting penile cancer. God, Lord, you don't want to have penile cancer. It reduces your chance of getting head and neck cancers, male and female, related to HPV. So there's no way that you can justify not getting the HPV vaccine. And I advocate it all the time. And I'm attacked mercilessly, but people don't understand. When I'm asking a 11-year-old and 12-year-old, that's the time you're supposed to get the HPV vaccine. In fact, you can even extend it to 26-year-old or 28-year-old. But that's the time we want it. And it's free of cost and readily available here. They'll attack me on the radio or social media. I'm advocating for 11 and 12-year-olds that have sex.
Yeah.
They're missing the point considerably. We're trying to prevent them from getting cervical cancer 20 years down the road, 30 years down the road.
I do want to jump in there. I'm sorry if I'm controlling this.
No, you're good.
But I see a theme, right? Okay, so you mentioned the fact that when it comes to the HPV vaccine, you get a lot of pushback from parents. And then you mentioned the fact that people are not going to get their pap smears. People are not going to get their annual physicals. They're not getting the blood tests that can make all of the difference.
And NHI means it's free.
You even talked about the fact that our diet is kind of diametrically opposed to what we ought to be doing for longevity.
Yes.
It just seems like we don't want to be sick, but we don't want to take any medical advice, or we don't want to do the right things. Is it because people are ignorant, or they don't get the gravity of the situation?
I think it's a little bit of both, particularly men. They'll say, when it's my time, it's my time. When I die. But they don't realize what dying of uncontrolled high blood pressure does. First of all, you're going to be on dialysis. You're going to be waking up 3 times a week, 4 o'clock in the morning to get dialysis. You're going to be in and out of surgery, getting an AV fistula to get your dialysis. You're going to be praying for a kidney transplant that's unlikely to happen. And even if you do get a kidney transplant, you're going to have to be on immunosuppressive drugs that put you at risk of innumerable infections. You're going to be in and out of hospital just based on that. The average kidney transplant only lasts 12 to 15 years. So let's say you get a kidney transplant when you're 50 or 45. You're going to need another kidney transplant at some point. So why are you going to live your life like that? The average person in this country as a male lives 2 to 5 years on dialysis. That'll kill you faster than anything. And there's so many men who are not either emptying their bladder, or they have uncontrolled blood pressure or diabetes, and that's leading to their kidney failure. And I'm talking about I've seen 20-year-olds die of kidney failure. 20-year-olds. I'm seeing 8-year-olds who have hypertension, who are 80 pounds overweight. Our society is one of the most unhealthy societies there in the world. We have the 4th highest incidence of obesity in the world. We have one of the highest rates of hypertension and diabetes. 1 in 7 of us are either pre-diabetic or diabetic. We have too much fats, too much red meats, too much charred meats, too much carbohydrates, and too much of a volume in our plates of all of those.
I want to put this, we have an international audience, but I'm just going to single this out for the Bahamian people right now, right? Let's just say a typical Sunday spread of a Bahamian plate or a Bahamian meal. You got chicken, you got fish, you got peas and rice, you got potato salad, you got macaroni.
Well, the white meat, the chicken is good, the fish is good.
Plantain, right? So let's just say one Sunday they have all these options. Most times all that's going to be on that plate. But if they had to choose between the lesser of evils, or if they had a family function, they didn't want to, offend Grammy. What is the best way to put the Bahamian plate together that's not going to be that detrimental?
Grab for the fish, grab for the chicken, have smaller portions, have salads with a sparing amount of one of the carbohydrates. So eat less. And then when you do have a big meal once in a while and merriment with family and friends, you know what? Use that to motivate you to go and work out, right, or go to that exercise or whatever, so you can shed all those calories that you've taken in.
Keyword, you said once in a while, not every Sunday.
Not everything is in moderation, even alcohol. Reduce your alcohol intake, Bahamas and throughout the world, and you reduce your cancer risk, you reduce your risk of non-communicable diseases considerably. If we eat right, there's no reason why the typical Bahamian male and female won't live to 90 and have a good 90. You don't want to be in and out of hospital and not enjoying those last decade on this earth. Let's live as long as possible, as best as possible. God only gave us one life. One of my colleagues likes to say, if you were given one car, and there's no way to repair certain things that happen to the car, and there's no way to buy a new car, wouldn't you go for an annual tune-up and check-up, and anything that's rattling or any sound that's happening or smoke from the engine, aren't you going to check on it? because that's the only one car you have. Once it stops on the side of the road and falls apart, that's it. And that's what our bodies are. So be more preventative. Go for those, and you'll take your car for a tune-up twice a year. You won't go 20 years without getting a tune-up for yourself. What does that say? That's just ignorance. Wow. Because all you're going to do is the same white coat you don't want to see, that's all you're going to see.
No. And you're going to need it. So for people, I mean, I'm just giving the benefit of the doubt. Obviously, we know men kind of need a little nudge to get into the doctor's office. But for the women, I'm imagining maybe cost is an issue. What do you say to the people?
But there is no reason for that, because we have NHI, where you can, quote unquote, see a primary care physician or a general practitioner, or even some internists are on NHI for free. That means you don't have to go into a busy government clinic and wait for this and wait forever for bloods. And you can go and be treated like a private patient for free. You can get certain images that are required that year for free. You can get your bloods done several times a year for free. So where is that an issue? And it's beyond that. Particularly for the Caribbean, we have a relatively high rate of insurance, particularly because of the government giving insurance to a lot of their employees. Even when they have insurance, they're not going to use it. So what's the excuse there? There's absolutely no excuse.
So we are the problem.
We have a massive problem.
No, I'm saying we are the problem.
We are the problem, and we have a massive problem because of that. Yes. Yes.
All right, let's talk hope. What are some of the simple practical steps, men in particular can take to add to years of their life? And, I think the quote is, add years to their life and add life to their years.
So what we do in our youth, we pay for in our older years. So if you're unhealthy, an obese infant has a much higher rate of incidence of being an obese adolescent. An obese adolescent has a greater risk of developing diabetes, hypertension when they become a young adult, and being obese. So we need to capture the women who are pregnant and make sure they get exercise, that they're eating and living healthy lives, that when their children are born, that they make sure that they give breast milk. That's the healthiest thing that we can do for even later in years in terms of immunity and everything else. Make sure that we breastfeed our kids for as long as possible. But we also have to look at the quantity. A lot of babies are overfed. They're overfed with the formula. Even in terms of breast milk intake, they're overfed. So they're, with all that, look at that cute, chubby baby. They're obese. And then that continues into childhood. So we need to talk about getting kids active from 6 years old, from 7 years old, eating healthy snacks. No kid should be having sodas. All the fried food should be done away with. We need to institute healthy breakfasts, healthy lunches, healthy dinners for children in small portions, and we need to get kids active from young. And that becomes a part of their psyche where they're used to exercise.
This is normal life.
They're used to eating right. They're used to healthy lifestyle. And that includes not being sexually promiscuous. That means using a condom. That means not getting pregnant when you're 15 years old and changing the trajectory of your life forever, or getting hepatitis. Hepatitis will kill you before HIV, because that's going to give you liver cancer.
Ooh. Wow, I never heard
I've never heard that.
HIV is essentially on the level of diabetes, because we have antiretroviral drugs that make it basically a chronic illness. No one should be dying of HIV. But diabetes, poorly controlled diabetes, insulin-dependent diabetes, that can rearrange your whole life and cause havoc on your health. So we want to avoid getting syphilis, gonorrhea, HPV, all of those sexually transmitted diseases. Even if we treat it, increase your risk of getting prostate cancer later in life. Wow. So what we do in our teenage years, there are too many Bahamian men who are young, even some of the old ones, they feel that they're Teflon. Nothing can touch them. Whatever happens, happens. I'm not the one who's going to get HIV. I'm not the one who's going to get hepatitis. Herpes, you carry it around like luggage. You'll never get rid of herpes. You can take all the antivirals in the world. Every time you have stress, you're going to get a breakout. Imagine being in a new relationship and then you get a breakout of herpes.
Whoa.
And that can be for life. So why are you going to subject yourself to that? Change the whole trajectory of your life when you shouldn't be having promiscuous sex. You shouldn't be so irresponsible. And there are too many of us in our society that are having children. They're not ready to be mothers. They're not ready to be fathers. And that is just causing our generation by generation to actually get worse, not better.
When you talk about all these diseases and you talk about all these factors, really what I hear is a lot of our illness is a lack of discipline, whether that be with the food we eat, whether would that be our willingness to exercise, whether that's with our sexual practice.
We have our destiny in our hands. What we do or don't do can affect our longevity and the quality of our life. And for men, the motivation for them is if you want to get your erections into your 80s, then make sure that you see your physician at least once a year. You get your annual physicals. You eat right. You live right. You don't have a dangerous lifestyle, sexually or otherwise. You don't go driving drunk. That'll kill you, or you go and kill somebody else, and you're going to end up in Foxtail prison. Live life like you love your fellow man, like you love your family. Do it for your family. If you're going to go down the road of being in and out of hospital with cancer or chronic illnesses, that takes a toll on your family. That takes a toll on your wife, your girlfriend, your kids, your grandchildren, your nieces, your nephews. Why put them through that? Look at your baby now and say, you know what, when I go out on the golf course and I'm smoking these cigars and I come home, you can say, oh, I don't inhale. Those carcinogens and those toxins permeate your hair follicles. They permeate your skin. You're going and then go pick up your baby whose organs are forming, where you can develop DNA denaturing and put your baby on the road to getting cancer. So stop being irresponsible.
Wow. I know we don't have that much time, but that's a whole other conversation. We probably have to have you back out there for sure.
No, not a problem. My pleasure.
My final question is, what screening should men prioritize and at what age should they start?
An annual physical includes screening for everything. And that includes the number one killer. We talk about cancers. The number one killer is cardiovascular disease worldwide. And that's heart attack or stroke. When most people die, they haven't even had an autopsy. Oh, he died of a heart attack. Or he died of a stroke. Statistically speaking, probably he did. But unless we had an autopsy, we just don't know. Even if he had all the risk factors for it, doesn't mean he necessarily died of that. But we can prevent that from happening. No one should really be dying of a heart attack. We have so much in terms of intervention, in terms of angioplasty and cardiac stenting, lifestyle modifications in terms of Lipitor for hypercholesterolemia. So we can prevent you from getting obstruction of your arteries. We can prevent you from getting heart attack or stroke. And as I mentioned earlier, that might be an early sign of that might be erectile dysfunction. Let's figure that out at that point when you're younger before it happens when it's too late. So don't wait for symptoms. Get your annual physicals. Liquid biopsies are the future of cancer screening in this part of the world and every part of the world. In the Bahamas, it's already here. So we can pick up prostate cancer many years before PSA blood test shows it, before MRI shows it. When we do biopsies now, we do genetic testing on the biopsies to determine in stratifying patients as to, all right, you're at a higher risk of a more aggressive form of the disease, and you're at a higher risk of a recurrence. So we can stratify that, and we use artificial intelligence as well. Artificial intelligence pathologists in determining and trying to look at the slides and the histology of the slides. They use artificial intelligence to make to increase their sensitivity and specificity and have a more accurate diagnosis. We use artificial intelligence in terms of stratifying patients as to high risk and low risk. I do that all the time in prostate cancer. So as I said, no one needs to be dying of prostate cancer. No one needs to be dying of colon cancer. A colonoscopy is not just diagnostic, but therapeutic. Before you get colon cancer, you're going to get a polyp, which is pre-malignant, then becomes malignant, then you get the colon cancer. If we can do a colonoscopy to remove that polyp, we can prevent you from getting colon cancer. Again, every colon cancer death is a tragedy because it never had to happen. Every prostate cancer death, which is 100 men a year or more, is a tragedy that doesn't happen. And the impact on our society is profound in every aspect, emotionally, financially, every aspect. Every one of us knows someone who died of prostate cancer, and it didn't happen. Every one of us knows someone who died of colon cancer, and it didn't happen. No one should be being diagnosed with prostate cancer at an advanced stage. No one needs to be dying of that needless disease. No one needs to be diagnosed with breast cancer at an advanced stage. So we need to change the whole trajectory of our society and live healthier and live better.
And just to wrap it up, I definitely just want to make sure it's very clear, especially to us men, how important what Dr. Pinto is saying, because, when we think about, even from my perspective and providing for my family, you think you're doing everything, working and all that stuff. You have your kids, but your family heavily depends on you as well. Imagine one day from something that you could have prevented if you just went screening, that now you're the one that everybody has to take to the hospital every now and then, or, prematurely leave. Like, what position that you're putting your loved ones in and your family members, your mother and your sister. So just from this conversation alone, just making sure you hear the words that Dr. Pinto is saying and take them seriously. Because like you say, seeing a white coat once or twice a year is better than seeing them every other week.
Yeah.
Exactly that. And that can save your life. And that increase the longevity of your life. And for Bahamian men and men throughout the world, maintain their erections until their 80s. That's the dream of any man.
Yes.
The only way to do that is to get your annual physicals. And not only that, we can have the best health system in the world. NHI, get everybody insured, get everybody in to get their physicals and pick up, for example, high blood pressure or early diabetes. But if they don't accept it, how many men say, I don't take that on? Nope, I'm not taking the blood pressure medication. Or I'll take it for 2 weeks and stop taking it. And they'll live in ignorance because he said, you know what? I'm only going to take my blood pressure medication when I get a headache or I'm going to black out or I have blurred vision. I'm only going to take my diabetic meds when I'm vomiting or feel nauseous. By that time, you've done untold harm to your body.
Wow.
The kidneys are the first one. And for men, it's your erections. They're going to be irreversibly damaged. For anything in medicine, erectile dysfunction as well, you treat the root cause because that's going to prevent you from, we can treat the symptom. You can go and get something from your gas station cashier
Viagra,
and you take that at your risk, because those are not FDA approved and they've never gone through any human trials. And studies have shown that many of those things are so harmful. They have sawdust in them. They have lead paint in them because they're made so cheaply. They'll have an active ingredient that's found in Levitra or Viagra or Cialis that'll give you an erection. But if we don't treat the root cause, it might be low testosterone.
Wow.
If we don't treat the root cause, it might be hypertension or diabetes or early coronary vascular disease. Those drugs are going to start failing in 2 years, 3 years. And by that time, you've already done irreversible damage to not only your male member, but other organs as well. So then you're starting to worry about losing your eyesight. Then you're going to develop kidney failure. So before we put you on that road, please, let's figure out why you have the erectile dysfunction. It might even be psychological. So we have to look at a person as a whole. We always talk about the physical. There are too many persons in this country are dealing with depression, or dealing with mental anguish, or dealing with post-traumatic stress disorder from being a crime victim or seeing all the violence in our society. And that includes kids as well. Wow. So we need to treat patients as a whole, not just the physical, but also the mental and emotional. And that can manifest in terms of physical symptoms as well. If you're not sleeping because someone came into your house 3 months ago with a gun put to your head and your children are failing in school and everything else, that's where our society is going to fail as well. We need to address our social ills just as we are addressing our medical ills as well.
Dr. Pinto, where can we find out more information about you and your practice?
I have a Facebook page, Urology Care Bahamas, and a website, urologycarebahamas.com. And my main offices is at, the main office is Oak Tree Medical Center, which is 5th Terrace in Mount Royal. And I'm also at Family Medicine Center on Blake Road.
Honestly, this has been a refresher and a great refresher conversation, because honestly, I've had my awakening. Honestly, from a conversation that you two had on another show that Davrielle hosts, and she came home just raving about the conversations that you had, which really had a big trajectory in my life.
Well, I mean, this is only the tip of the iceberg. If we had hours, I would speak endlessly about things that we can do to improve the health of our nation.
That's why we're going to have a part two.
We're definitely going to have you back.
Yes. But thank you so much for joining us.
It's my pleasure. Thank you for having me.
Yes, thank you.